Good afternoon. So today we will discuss chemotherapeutic agents or antibiotics that are used in periodontics. We'll see introduction to what antibiotics are used in for the treatment of periodontal disease. Then what is the rationale behind the use of the antibiotics or chemotherapeutic agents in treatment of periodontal disease. Then what systemic antibiotics are used in periodontics to treat periodontal disease. Then local drug delivery, and lastly conclusion. So as you know, antibiotics are widely used for treatment of various diseases. Similarly, antibiotics are used in the treatment of to treat periodontal disease, mainly chronic periodontitis as well as aggressive periodontitis. So the term antibiotics was used by or firstly coined by Selman Waxman in the year 1942. So he was the author who had coined the term antibiotics. So antibiotic term is nothing but it is a Greek word. So anti, it is a Greek word. So anti is against and bios is life. So it is antibiotic. So antibiotic is a substance or a chemical that is used to kill bacteria or inhibit the growth of bacteria. So it may be a bacteriostatic or bactericidal. So effect of these antibiotics can be bacteriostatic or bactericidal. Either it may kill the bacteria or it may inhibit the bacteria. So the first antibiotic that was used in medical was penicillin. So Alexander Fleming was the author. He has used the penicillin. Firstly, the first antibiotic, natural antibiotic, was discovered by Alexander in the year 1928. So the antibiotic. So now coming to whenever, as you know, periodontal disease is a multifactorial disease or multiple bacteria are involved in the progression of the periodontal disease. So to treat this bacteria, we are using the first line of treatment is non-surgical therapy. As we know, non-surgical therapy is by your scaling and root planing. So in addition to this, whatever bacteria have invaded your soft tissue, whatever bacteria have invaded into your soft tissue, deeper into your soft tissue, this can be treated by using your systemic antibiotics as well as your local antibiotics. That is, local antibiotics is usually done by your local drug delivery. So today we are going to discuss what systemic antibiotics are used in periodontics to treat periodontal disease. So before this, there are various terms you will come across while going through this chapter. So there are various terms. For example, first term is chemotherapeutic agents. So what do you understand by the term chemotherapeutic agent? So chemotherapeutic agent, it is a general term for a chemical substance that provides a chemical therapeutic benefit. In simple terms, whatever chemical substance you are going to use, and that substance will definitely benefit your clinical outcomes. So this is chemotherapeutic agents. Another term is anti-infective agents. So anti-infective agent is nothing but it is a chemotherapeutic agent that works by reducing the number of bacteria present. In simple terms, it is nothing but a chemotherapeutic agent that reduces the number of bacteria present. Another term is antimicrobial agents. So antimicrobial agents designate synthetic as well as naturally obtained drugs that accentuate the microorganisms. So this is antimicrobial agents. Another term is antibiotics. So antibiotics definition is it is nothing but it is a naturally occurring, it may be a naturally occurring, it may be semi-synthetic or synthetic type of anti-infective agent that destroys or inhibits the growth of selective microorganisms which generally at a lower concentration. Whatever antibiotics we are using, this may be naturally occurring, it may be semi-synthetic or synthetic. that may destroy or inhibit the growth of selective microorganisms, generally at a lower concentration. Another term is antiseptics. So antiseptics is nothing but it is a chemical antimicrobial agent applied topically or subgingivally to mucous membranes, wounds, or intact dermal surface to destroy microorganisms and inhibit their reproduction or metabolism. So in simple term, antiseptics, these are these are applied topically or subgingivally or to your intact wound or dermal surface that destroys microorganisms and inhibits their reproduction or metabolism. So another term is disinfectants. So disinfectants is a subcategory of antiseptics. So disinfectants are nothing but these are antimicrobial agents that are generally applied on your innate surface. That is, for example, your instruments. So whatever disinfectants you are using that are usually applied on your innate surfaces, that for example is your instruments, to destroy microorganisms. So antibiotics, we will come to antibiotics that are used in periodontal therapy. So the value of administering antimicrobial agents as a quick and inexpensive means of augmenting mechanical periodontal debridement is worthy of consideration. So periodontitis patients may benefit definitely from your systemic antibiotics as well as topical antibiotics and topical antiseptics. So what is the rationale behind use of these chemotherapeutic agents in periodontics? So as we know, the microbial etiology of any inflammatory periodontal disease is the main etiology for progression of disease. So microbial etiology of inflammatory periodontal disease provides the rationale behind for use of antibiotics in periodontal therapy. Then the ability of microorganisms to cause disease depends upon the characteristics end products. Whatever end products is there of bacterial metabolism, the chemical composition of bacterial components, and its ability to overwhelm the host. Systemic antibiotics may be a necessary adjunct in controlling bacterial infection, whatever bacteria have invaded the periodontal tissues, in addition to your mechanical therapy. So, in addition to mechanical therapy, systemic antibiotics may also be used and it will be beneficial for the host. So, what are the ideal requisites or properties of your antibiotics? So, your antibiotics, first, it may be toxic to the microbes and not to the humans. So, this is the ideal requisite. So, your antibiotics should be toxic to your microbes and not to the humans. So, it should be bactericidal rather than bacteriostatic. It should be bactericidal rather than bacteriostatic. It should be specific for periodontal pathogens. So periodontal pathogens usually are divided three three complexes: red complex, green complex, orange complex. So whatever periodontal pathogens are there, it should be this antibiotic should be specific for your specific pathogen. It should not be allergic and it should not be hypersensitive. Hypersensitivity reaction should not be produced by any systemic antibiotics. So another property or ideal requisite of your antibiotics is it should be active in plasma and not any other body fluids. So desired level of your antibiotics should reach rapidly and should be maintained for an adequate period of time. Another property is it should not cause any drug resistance and it should have a long shelf life. Shelf life of any drug that are used to treatment in the periodontal disease, it should have a long shelf life. And most important is it should be inexpensive. Now coming to classification of antibiotics that are widely used in treatment of periodontal disease. On the basis of first classification is based on the basis of your chemical structure. So based on your chemical structure, antibiotics are classified into sulfonamides and related drugs. Example is sulfadiazine. Second classification is by quinolones. Quinolones usually the nalidixic acid and norfloxacin are the quinolones. Then beta-lactam antibiotics, example is penicillin. Then another group based on your chemical structure is tetracyclines. These are widely used in the treatment. Tetracyclines are widely used in the treatment of periodontal disease. Then comes the aminoglycosides. Another group is macrolides. Then glycopeptide antibiotics and nitroimidazole. That is mostly we use metronidazole in the treatment of periodontal disease. Second group of classification is based on your mechanism of action. Some drugs have their effect on the cell wall synthesis, some have effect on your DNA, some have effect on your mRNA sequence. So depending on this mechanism, the drugs they are classified into the drugs that inhibit cell wall synthesis usually are penicillins, cephalosporins, and vancomycin. So these are the examples of drugs that inhibits your cell wall synthesis. Second group is cause leakage from your cell membrane, that are bacitracin and nystatin. There are some drugs which inhibit protein synthesis. So mainly tetracycline drugs that is used in periodontal treatment for aggressive as well as your chronic periodontitis or refractory periodontitis. So tetracycline generally inhibits the protein synthesis of your microbial periodontal pathogens. So tetracycline inhibits the drugs that inhibits protein synthesis are tetracycline, chloramphenicol, and erythromycin. There are some drugs that cause misreading of mRNA and affect the permeability of your cell membrane. That is, example is aminoglycosides. Then there are some drugs that inhibits DNA gyrase. So example is fluoroquinolones. Interferes with DNA function, that is metronidazole. So metronidazole is widely used drug in the treatment of periodontal disease. So function of metronidazole is usually it interferes with the DNA function of your cell or bacteria. So interferes with DNA synthesis is your antiviral drugs. Usually they interfere with DNA synthesis, and interferes with intermediary mechanism is sulfonamides. So example is sulfonamides. The third classification based on group of microorganisms, whether our antibiotics, systemic antibiotics, usually they are antibacterial, whether they are antifungal, whether they are antiviral, antiprotozoal or antihelminthic. Based on this group of microorganisms that actively act, which act against primary actives. So antibacterial, usually the drugs are penicillin and aminoglycosides. So antifungal drugs are rhizophilin and amphotericin B. Antiviral drugs acyclovir. Antiprotozoal drugs are chloroquine and pyrimethamine. And antihelminthic drugs are mebendazole and pyrantel. So these are the classification based mainly on the group of microorganisms that are mainly affected by the drugs. Also, antibiotics are usually classified based on your spectrum of activity. That is, they are broadly classified into narrow spectrum and broad spectrum antibiotics. So, example of narrow spectrum antibiotics is your penicillin G and erythromycin. Broad spectrum antibiotics usually are chloramphenicol, tetracyclines. Also, antibiotics are classified based on type of action, whether they are bacteriostatic or bactericidal. So mostly whatever drugs you are going to use in treatment of periodontal disease, usually they should be bactericidal rather than bacteriostatics. So example of bacteriostatics are sulfonamides, tetracyclines and erythromycin. And bactericidal drugs examples are penicillin, aminoglycosides and cephalosporins. So what do we understand by the term bacteriostatics? So bacteriostatics, these are nothing but they just inhibit the growth of bacteria. They inhibit the growth of bacteria. Whereas bactericidal drugs, they usually are bacteria, they kill the bacteria rather than and this bacteria and this process is usually irreversible. Whereas bacteriostatics, they just inhibit the growth of bacteria. Also, antibiotics are classified based on the source of antibiotics, whether they are derived from fungi, whether they are derived from bacteria, or they are derived from actinomycetes. So, penicillin is the drug that is mainly derived from fungi. Also, there are some bacteria that are derived from your bacteria, that is polymyxin and bacitracin. So these two antibiotics usually are derived from bacteria. Various antibiotics are derived from actinomycetes, that is aminoglycosides, macrolides, tetracyclines, and chlorophenol. So these drugs usually are derived from your actinomycetes source of antibiotics. Then now coming to what are the indications for use of antibiotics in your periodontal therapy. So the first indication is the patients who do not respond to your conventional periodontal therapy. Whatever conventional periodontal therapy or non-surgical periodontal therapy you are performing, like scaling and root planing, as well as your curettage, gingival curettage or subgingival curettage. After doing this periodontal therapy, the patient is not responding to this periodontal therapy, then we are prescribing systemic antibiotics. In addition to your non-surgical therapy, we are prescribing systemic antibiotics. This is the first indication for use of antibiotics in periodontal therapy. Second indication is the patients who have active infections. For example, in case of pericoronitis patients or anal, whatever patients usually have necrotizing ulcerative gingivitis patient, in those patients we are usually prescribing antibiotics. So patients with active periodontal infections, examples are pericoronitis and periodontal abscess. So in those cases we are giving systemic antibiotics. So this is the second indications for use of antibiotics in periodontal therapy. Third one is, for example, in medically compromised patients, we are using for as a prophylaxis. So whatever medically compromised patients are there, we are using antibiotics as a prophylactic use. And last one is for adjunct to surgical as well as non-surgical periodontal therapy. Whatever surgical treatment you are doing, we are using. So we are using in adjunct to this surgical as well as non-surgical periodontal therapy. So there are some guidelines for use of antibiotic therapy. So first is the clinical diagnosis and situation dictate the need for possible antibiotic therapy. So we have to take detailed case history and we have to come to a diagnosis whether the case is of chronic periodontitis, whether it is of aggressive periodontitis, or whether the case is of refractory periodontitis. Based on these guidelines, we have to use antibiotics. Second guideline for use of antibiotics is disease activity. On clinical examination, whether there is continuous attachment loss, whether there is purulent exudate, whether there is bleeding on probing. So these all factors, clinical parameters should be taken into consideration before administering any systemic antibiotics. So antibiotics usually they are selected on patient's medical and dental status, current medications, and result of antimicrobial analysis. So for before this prescribing antibiotics, we should always do antimicrobial analysis. So microbial analysis should be done because specific antibiotics are used for specific type of bacteria. So before administering this, we have to do microbial analysis if possible. Also, microbial complex plaque samples are usually obtained and they are sent for lab, and depending on this, we are prescribing the systemic antibiotics. So there are some guidelines. So first guideline is you have to diagnose the case, whether the case is healthy, whether the case is having periodontitis, or whether the case is of aggressive, refractory, or any medically compromised patients are dealing with your periodontitis. So after this diagnosis, we are planning for your treatment plan. If the patient is healthy, then that patient is usually kept on your supportive periodontal therapy. If the patient has systemic chronic periodontitis, Then you are performing periodontal therapy, oral hygiene measures, root scaling, root planing, and then antibiotics are prescribed to this patient based on your microbial analysis. If this treatment, non-surgical as well as surgical, and in addition to your antibiotics, if the patient response is good and the treatment is effective, then those patients usually are kept on your supportive periodontal therapy. If the patient has if the treatment is ineffective, then we have to come whether the diagnosis, whatever diagnosis we have done, whether the diagnosis is proper or not, we have to just evaluate and we have to come to a diagnosis. Third diagnosis is your aggressive periodontitis patients, also aggressive periodontitis patient. So these patients or refractive periodontitis patient. So for this patient, as well as microbial periodontitis, for these patients we have to do microbial analysis. So we have to do microbial analysis, and based on this we have to prescribe your systemic antibiotics. After the treatment is successful, then those patients usually are kept on a supportive periodontal therapy. So whenever you are using systemic antibiotics to treat periodontal disease, so systemic antibiotics usually have, they may have some adverse effects. So adverse effects, first one is the patients may be allergic or the patient may have anaphylactic shock. So anaphylaxis can also be seen in patients who are having adverse effects of your systemic antibiotic. Second one is superinfection or opportunistic infection. Whenever you are prescribing antibiotics, the patients develop superinfection in response to this antibiotic. The second adverse effect is superinfection. Third is development of resistance. If a patient is medically compromised and he is using systemic antibiotics for a longer period of time, those patients can definitely develop your resistance to those particular drugs. Another is interactions with other drugs. Suppose medically compromised patients are using their drugs. So whenever you are prescribing systemic antibiotics, with these systemic antibiotics, there may be some drug reactions. So interaction of drugs should be taken into consideration before prescribing your systemic antibiotic. Also, there are some common adverse effect, that is stomach upset. Patient may develop nausea, patient may develop vomiting, and most common is GIT upset. So these are various uh, adverse effects of your systemic antibiotics. Now coming to how to choose a antimicrobial agent. So there are some factors before choosing any antimicrobial agent. We should take these factors into consideration. So the first factor is the patient's factor. So in those patient factor, first comes age. Depending on the age, we have to prescribe the antibiotics, because tetracyclines usually they are avoided in patients in if whenever children's, usually we generally avoid tetracycline drugs. So in children, because this may develop stains. Second is patient factor is renal and dysfunction. Whenever patient has any systemic history related to renal or any liver disease, so renal failure patients, usually aminoglycosides, usually they are usually avoided in those patients. The patient has liver disease, then erythromycin and tetracycline should be avoided. Then is local factors. Second factor is, first is patient's factor, second one is local factors. In local factors, presence of pus secretions decrease the efficacy of your antimicrobial agents. Whenever there is pus and you are prescribed, so this will definitely, the presence of any necrotic material or foreign body may irrigate the infection practically impossible. The second factor, organism related considerations, we have to take the clinical diagnosis, culture and sensitivity testings should be performed before. Then microbial testings. So microbial testings should be completely initiated to determine which species are present, which and the most effective antibiotic for targeting them. So microbial testings should be performed before prescribing any antimicrobial testing. Then drug factors based on specific properties of antimicrobial, whether you have to prescribe antibiotics, whether it may be narrow spectrum or broad spectrum antibiotics. The type of activity, whether you have to prescribe bactericidal drugs or bacteriostatic drugs. Then sensitivity of the organism depend on the based on your MIC, that is minimum inhibitory concentration values. Based on these values, we have to prescribe whether the drug antibiotic should be prescribed. It may be narrow spectrum or broad spectrum. And relative toxicity, the drug that whatever you are going to prescribe should be less toxic rather than it should be more toxic. So now coming to for how longer duration we have to prescribe the drug. So the duration usually is the shorter duration that is used in to treat periodontal disease. You should treat both clinically and microbiological response. So in to treat periodontal disease, usually now coming to administration of the drugs that are going to be used in to treat periodontal disease. So by two methods we can administer the drugs. One is by systemic administration and second one is by local administration. So coming to first, what are the advantages of using a drug systemically? So first one is simple. The advantage of using systemic drugs is it is simple, easy administration of drugs to your multiple sites and elimination of the reduced pathogens on oral mucosa and extra dental sites. What are the disadvantages of use of systemic antibiotics? So inability to achieve higher GCF concentration. For any drug to act, it should achieve high GCF concentration. Increased risk of adverse drug reactions. Whenever you are prescribing systemic antibiotics, there is increased risk of adverse drug reactions. Then increased selection of multiple antibiotic resistance, because for specific bacteria you are not prescribing, so this will develop your antibiotic resistance and uncertain patient compliance. So these are disadvantages of use of systemic antibiotics. So what antibiotics usually are prescribed in periodontics? So first is tetracycline, second one is doxycycline, third one is clindamycin, fourth one is amoxicillin, fifth one is minocycline, sixth one is erythromycin, ampicillin, and last one is metronidazole. So this group of antibiotics usually are prescribed to treat any periodontal disease. So these drugs usually are widely used in the treatment of periodontal disease. So we will discuss the drugs that are frequently used to treat periodontal disease. So first is tetracycline. It is mostly widely used drug in the treatment of periodontal disease. So tetracycline is nothing but it is produced naturally from streptomyces and it is derived also from semisynthetically. So tetracycline, the mode of action usually is bacteriostatic. So this drug, whatever you are using, is bacteriostatics rather than bactericidal. So concentration in GCF it has found to be 2 times greater than in serum. So the level of tetracycline is more in GCF rather than your serum. So the mode of action of tetracycline is inhibition of your protein synthesis. This tetracycline binds to your 30S ribosome in the DNA. So this will definitely inhibit the growth of your bacteria. So what are the uses of tetracycline? In those cases, one is adjunct in the treatment of localized aggressive periodontitis. Also, it arrests bone loss and suppresses the bacteria, that is Actinobacillus actinomycetum comitans. So the drugs, this drug is used in addition to your non-surgical therapy, that is after scaling and root planing, we are giving these drugs in the treatment of localized aggressive periodontitis. So what is the dose of this drug? So dose of this drug is 250 milligrams 4 times daily. we have to give it for near about 7 days. Okay, 250 milligrams 4 times, that is QID for 7 days. And these drugs usually is inexpensive. Second drugs are minocycline and doxycycline. So these drugs usually are semi-synthetic membranes of tetracycline groups. So minocycline is a broad spectrum antibiotic. It suppresses motile bacteria as well as your spirochetes, can be used in adjunct to your, and these drugs usually dose is twice daily for 7 days. The dose of this drug is 200 milligram twice daily for. Another drug is doxycycline. It is a broad spectrum antibiotics. So minocycline, it is, so doxycycline usually the recommended dose is 100 milligram BID for first day, then 100 milligrams OD for near about 21 days. So dose of this doxycycline is, firstly we have to give 100 milligram tablets BID for first day, later on 100 milligram OD for 21 days. So it will reduce. So another drug is metronidazole drug. So these drugs mainly used for gram positive as well as gram negative bacteria. So gram negative bacteria usually are more affected by this metronidazole. So mode of action of metronidazole is inhibition of DNA synthesis. Whatever during mitosis it takes place. So metronidazole usually inhibit the DNA synthesis. So clinical use, what? So metronidazole is mainly used in cases of periodontal abscess. Also in cases when patient is having pericoronitis. So use of this metronidazole is pericoronal abscess as well as periodontal abscess. In addition to this, we are using in necrotizing ulcerative gingivitis cases. So next indication is for necrotizing ulcerative gingivitis. Next indication of metronidazole is chronic periodontitis cases. Whenever patient has diagnosed with chronic periodontitis, we are using metronidazole. And lastly is aggressive periodontitis. So the dose of these antibiotics is 250 milligram TID for 7 days. So metronidazole we have to prescribe 400 milligram TID for 7 days. So what are the, there are some adverse effects of metronidazole. One is there are severe cramps in your GIT, nausea, vomiting, and most is metallic taste. Whenever you are prescribing metronidazole, patient usually complains of your metallic taste. So this metronidazole should be avoided in patients who are taking alcohol and patients who are on anticoagulant therapy. So contraindications for metronidazole are patients who are having history of alcohol and patients who are on anticoagulant therapy. The next drug is penicillin. So penicillin is obtained naturally. It is a narrow spectrum antibiotic and it is bactericidal in nature. So it is used against gram positive as well as gram negative bacteria. So mode of action of penicillin is it inhibits the synthesis of bacterial cell wall. That is, it inhibits the cell wall synthesis. And clinical use is in case of aggressive periodontitis, both localized as well as generalized aggressive periodontitis. So recommended dose is 500 milligram TID for 8 days. Also, amoxicillin, that is amoxicillin as well as clavulanic acid, that is augmentin, is mainly used in the treatment of periodontitis. So indications of augmentin are it may used in refractive periodontitis or localized periodontitis. Next drug is cephalosporin. So cephalosporin, it is mainly used in patients who are resistant to a beta lactamase, that is penicillin. The mode of action is similar to penicillin, that is inhibition of bacterial cell wall. The clinical use is it mainly inhibits gram-negative bacteria and it is mainly used in aggressive periodontitis as well as refractive periodontitis cases. Next drug is clindamycin. So clindamycin is effective against anaerobic bacteria in patients who are allergic to penicillin. So mode of action of clindamycin is it inhibits protein synthesis by binding to 50S ribosomes. So clindamycin achieves higher levels of antimicrobial activity than any other drugs. So dose of clindamycin is 150 milligrams QID for 10 days. Next drug is ciprofloxacin. So ciprofloxacin, it is a potent inhibitor of gram-negative bacteria. So mode of action is inhibition of bacterial DNA replication and transcription by binding to DNA dirase. So clinical use is establishment of associated with periodontal pathogen. Then it is used in the treatment of aggressive periodontitis cases. So ciprofloxacin usually used in combination with metronidazole. The another drug is erythromycin. So clinical use of erythromycin is it is extremely safer drugs that is alternative to penicillin for allergic patients. Okay. In addition to this, so this is all about your systemic drugs, whatever you are going to use in patients with uh, chronic periodontitis or aggressive periodontitis. Now coming to local drug delivery. Okay, so some local administration of drugs is also done with the help of local drugs. So Goodson was the author who has used first drug for local administration. Okay, what are the indications of local drug delivery? So local drug delivery is also used in adjunct to your scaling and root planing. Also periodontal maintenance therapy. Also in patients who are medically compromised patients and to halt the progression of periodontal disease in patients with moderate or severe periodontitis. So classification of local drug delivery. So it is classified into personally applied and professionally applied. So personally applied is patients can use in home care self-care. Whereas professionally applied is it is usually applied in your dental office. So advantages of local delivery are these: they attain their 100% fold higher attention, higher concentration is obtained in these drugs. So disadvantages is placing it into deeper tissues of periodontal pockets and furcation involvement. So what drugs are locally used is tetracycline, doxycycline, minocycline, metronidazole, and azithromycin, and most important is your chlorhexidine. So these drugs usually are available in the market for local drug delivery. So this local drug delivery will be discussed in your host modulation chapter. Okay. So this is all about your chemotherapeutic agents that you are going to use to treatment in the periodontal treatment. Thank you.